Welcome everyone to today's webinar, Navigating the Link Between Alzheimer's Disease and Fall Risks, Understanding, Prevention, and Care. Today's webinar is facilitated by the Loop Fall Prevention Community of Practice. My name is Michelle Dukeman, and I am the manager for the Fall Prevention Program at Parachute. I'm going to go over a few housekeeping items next, but while I do that, we'd love to see who's joining us today. If you can, please let us know your role, organization, and location. That will give us a good sense of who is joining today. All right, everyone's favorite housekeeping. During the webinar, if you have questions about the technology, please use the chat box to get our attention. My colleague Marguerite will be monitoring this space for those types of questions. But if you have questions for our presenter about their presentation, about today's content, please submit those using the Q&A box that appears at the bottom of your Zoom window. Questions for our presenter will be answered at the end of the webinar. You'll only be able to view questions you have asked and not questions posed by other participants, so keep that in mind. And this webinar is being recorded, and a link to the recording will be sent to all participants in a few days, along with the link to the presentation slides. Many of you on the line may already be Loop members, but for those who are not, we encourage you to sign up. Loop is the no-cost online communication platform for the Fall Prevention Community of Practice. It brings together its members across Canada to problem solve and discuss how to implement evidence-informed and promising practices in fall prevention. And listed here on the slide are just a few of the services that Loop provides. As a reminder, the recording link and the presentation slides will be posted on Loop in a few days, and you can access the presentation slides and rewatch all Loop webinars from the past on our website or on our YouTube channel. And all of this information that I'm sharing right now will be in the post-event email, so don't be feverishly taking down any URLs or anything. And in case you missed it on the Loop discussion board or in our biweekly newsletter, there is a new Loop evidence summary available. The impact of ageism on physical inactivity and fall prevention among older adults. You can access the evidence summary by visiting Loop, and again, I'll include it in the post-webinar email as well. A heads up that our next webinar is coming quickly on March 6th. It's with Dr. Nicole Serra and focuses on preventing falls for people living with Parkinson's. I'd like now to introduce our presenter for today. Sandra Hong is the Public Education Coordinator for the Alzheimer Society Grey-Bruce. She has a background as a registered practical nurse and a certified master coach trainer for Gentle Persuasive Approaches in Dementia Care, and brings a wealth of expertise to her role. Over the past 34 years, Sandra has honed her skills and knowledge through various roles in hospitals, communities, and long-term care settings. In her current position, her primary responsibility is to educate healthcare professionals, care partners, and community members on best practices in dementia care through the programs offered by the Alzheimer Society Grey-Bruce. You can find a complete bio for Sandra on Loop, and without further ado, please take it away, Sandra. You can start sharing your screen.
Okay. There we go, I think. We're good to go, Michelle?
It looks great.
Okay, thanks a lot. Thank you very much for the introduction and for everyone for taking their time to attend this session today. I'm happy to provide you with hopefully some really good knowledge and understanding of how you can support individuals living with dementia. So today I'm wanting to discuss understanding Alzheimer's disease and related dementias, cognitive decline and fall risks, going over some prevention strategies, care and support, and lastly, you don't see it up there on the slide, but I'm going to talk a bit about some communication tips because that certainly is essential in supporting individuals living with dementia. So dementia is not a specific disease, but rather an umbrella term for a group of symptoms associated with a decline in memory or other thinking skills, severe enough to reduce a person's ability to perform everyday activities. It is caused by damage to brain cells, affecting an individual's ability to communicate with each other. Alzheimer's disease is the most common cause of dementia. It accounts for about 60 to 80% of cases. Other types include vascular dementia, Lewy body dementia, and frontal temporal dementia. So all true dementias are progressive. The symptoms increase over time. Researchers have not yet found a way to stop Alzheimer's disease and other types of dementia from progressing through the brain, causing more and more damage over time. While progress in research has been made, we still have a real long way to go. And how long this progression takes really depends on many factors. The type of dementia the person has, other health issues the person is living with, such as diabetes or heart disease, and other protective factors the person has. Cognitive reserve is one. So research shows that cognitive reserve is built over a lifetime through things like education, learning new skills, and socialization. The other piece to true dementia is the degenerative brain cells die. It's degenerative and those brain cells die. Alzheimer's disease and other dementias slowly destroy brain cells, the neurons, and disrupt the signaling between them. And lastly, it's irreversible. So damage cannot be repaired. Although recent research shows that the growth of new brain cells in the hippocampus is possible, these diseases cause so much progressive damage in the brain that any new cells, while possibly slowing down the progression, will not be able to actually overcome the damage caused by Alzheimer's disease and other dementias. Dementia is a global health challenge, and an estimated 50 million people worldwide are living with this condition. So in Canada, over 500,000 individuals are currently living with dementia, and this number is expected to double by 2030. The prevalence of dementia increases with age, with the majority of cases occurring in individuals over the age of 65. However, early onset dementia can also occur in people under the age of 65. So we can't just assume that these dementias just impact individuals over the age of 65. So the link between cognitive decline and fall risks in individuals with Alzheimer's disease and other forms of dementia is multifaceted. So Alzheimer's disease causes damage to brain cells, and this can affect the brain's ability to process sensory information and actually execute motor responses, leading to difficulties in maintaining their balance and coordination. Individuals may have kind of that reduced awareness of their environment, increasing the likelihood of not recognizing hazards that could lead to falls. So for instance, a person might not pay attention to a step and therefore they stumble, or there's the altered gait and mobility. That makes individuals more prone to shuffling or hesitating, or those uneven steps, which can increase the risk of tripping or losing balance. Poor judgment and decision-making abilities lead to the risky behaviors or the inability to assess the risks associated with certain activities or environments. And that's an example of that might be the person with dementia may not perceive a wet floor as slippery and therefore could fall. Some medications used to manage symptoms of dementia can have side effects such as dizziness and drowsiness or impaired coordination, which can increase the risk of falls. And coexisting health issues such as osteoporosis or arthritis or vision problems and cardiovascular disease can increase the likelihood of falls. So overall, the combination of these factors can significantly increase the risk of falls in individuals with cognitive decline, highlighting the importance of fall prevention strategies and interventions tailored to the specific needs of this population. Now, the 8 A's of dementia, they really do provide an insight into the cognitive and behavioral changes associated with Alzheimer's disease. So understanding these symptoms can help you prevent or minimize the risk of falls. And I often say minimize because we may not be able to prevent a fall altogether, but let's minimize the risk as much as possible. So the first of the A's is the amnesia. And the amnesia refers to memory loss, which is a common symptom of dementia. So people with amnesia may forget recent events or conversations or instructions. And that, of course, leads to confusion and disorientation. And this can increase the risk of falls. They may forget safety precautions or instructions. So a person with amnesia may forget that they need to use a walking aid or may not remember the layout of their home, leading to trips and falls. So what we want to do to try to minimize that risk is label objects and areas in the home that can help individuals with amnesia remember important information. So using visual cues such as colored tape on steps or handrails can also provide some guidance and prevent falls. For the aphasia, so aphasia refers to difficulties with language, including speaking and understanding and reading and writing. People with aphasia may struggle to communicate their needs or understand instructions related to fall prevention. And this can lead to misunderstandings or missed opportunities for assistance, increasing an individual's risk of falls. So a person with aphasia may not understand the verbal cues to slow down or may not be able to express discomfort that could indicate a need for help. So again, in order to minimize the risk, using simple, clear language and gestures can really help to improve that communication with individuals with aphasia. So perhaps providing written instructions or using pictures can also aid in understanding, in the understanding of safety precautions. The apraxia is the inability to carry out purposeful movement. So despite having the physical ability to do so, people with apraxia may have difficulty with activities that require coordination and planning, such as walking or using tools. And this can increase the risk of falls. They may struggle with balance and coordination. A person with apraxia may have trouble stepping over obstacles or navigating an uneven surface. So in order to minimize the risks, breaking down tasks into simpler steps and providing visual or physical cues, again, can help individuals with apraxia just perform those activities much more safely. So we really want to use assistive devices such as walking aids or grab bars that can help support the individual. The agnosia refers to the inability to recognize familiar objects, people, or sounds, despite those intact sensory functions. So people with agnosia may not perceive potential hazards in their environment. So that, of course, increases the risk of falls. And they may look at a chair but not recognize it as something to sit on. So then that leads them to try to step over it as if it were an obstacle. So what we want to do to minimize that risk is ensure a clutter-free environment with clear pathways, and that can help reduce the individual from falling with agnosia. Also, using contrasting colors or textures to highlight potential hazards can also improve that person's awareness of the environment. Altered perception refers to changes in how a person perceives their environment, which can affect their judgment and spatial awareness. So people with altered perception may misinterpret distance, size, or shape, and that could lead to missteps or collisions. And this can increase, of course, the risk of falls, especially in unfamiliar or complex environments. So a person with altered perception may perceive a step as lower or closer than it actually is, and thus could potentially fall. So in order to minimize this, providing some clear signage and markers in the environment can help individuals with altered perception navigate safely. So removing unnecessary visual clutter and maintaining consistent lighting levels can also improve perception and reduce those risk of falls. The altered attention refers to difficulties in focusing and sustaining or shifting attention, which can affect awareness of surroundings and potential hazards. So people with altered attention may be easily distracted or have trouble staying alert and increasing, of course, the risk of falls. So a person with altered attention may fail to notice a hazard like a loose rug or a step. So creating a calm and structural environment can help individuals with altered attention stay focused and aware. So again, what's important here is that we minimize those distractions and provide clear, simple instructions to improve the individual's attention. Big word here, anosognosia. So anosognosia is the lack of awareness or even a denial of one's own condition. So I often say to people, people with anosognosia, they don't know what they don't know. They forget what they forget. So people with anosognosia may not recognize their own limitations or the need for assistance. And that can lead, of course, to risky behaviors and increased fall risks. So a person with anosognosia may refuse to use a walking aid despite balancing issues, increasing the risk of falls. So this becomes tricky with care partners trying to support individuals with anosognosia. Just using gentle reminders and encouragement from care partners can help those individuals understand and accept their limitations, and providing constant support and supervision can also prevent risky behaviors that could lead to falls. And lastly, we have apathy. So apathy refers to a lack of interest or motivation or initiative, and decreased engagement in activities and self-care. So people with apathy may neglect safety precautions or fail to participate in exercises that can improve strength and balance. A person with apathy may not see the importance of using handrails or participating in physical therapy. So encouraging and motivating individuals with apathy to participate in activities can help improve their physical condition. Breaking tasks into manageable steps and providing positive reinforcement can also increase engagement and safety awareness for these individuals. So understanding these cognitive and behavioral changes associated with Alzheimer's disease can really help care partners and healthcare professionals tailor interventions to reduce the risk of falls and promote safety for individuals living with dementia. I just wanted to share with you the next two slides are just around the physical environment and how that can really um, support a person to decrease their risk of falls. And you'll notice um, that there's a lot of contrast in color here. The grab bars are quite visible. Even the contrast in the toilet seat, and there's no pattern in the floor. There's also items in the bathroom that are well labeled to kind of make the person feel a little bit more safe and comfortable in the environment so they don't become frustrated or confused, which could lead to a fall risk as well with the anxiety building up in the individual. So creating an environment that the lighting is, well, it's ceiling lighting, but it's bright lighting to help them navigate that environment easier. And this is of course, the interior environment. Looking at an exterior environment, again, you notice that the pattern on the pavement to make it less slippery if it's wet for individuals. There's tape on the, or not tape, paint on the stairways, and of course the handrails are nicely marked, and even the handles for the doors are contrasting color. Good lighting in the environment to decrease individuals from falling. And it doesn't matter in these cases whether the person has Alzheimer's disease or not. It is about making the environment a safe one for people to navigate. Okay, so the impact of falls on individuals with Alzheimer's disease. So the consequences of these falls, it certainly can be significant. Falls can lead to physical injuries, as we are all aware of. Fractures, head trauma, or sprains can further impair an individual's mobility and independence. Falls can also cause psychological distress, leading to fear of falling and reduced confidence in mobility, which can contribute to social isolation and decline in overall quality of life. So for care partners, falls can be a source of stress and worry. They oftentimes may feel overwhelmed by the responsibility of preventing falls and ensuring the safety of their loved ones. So care partners may also experience those emotional distress and guilt if a fall does occur, really despite their best efforts in even trying to prevent it. So a good example of that may be that if someone was in their early stage of Alzheimer's disease and perhaps is taking some medication that causes them to be dizzy and lightheaded, the person may have had a few near miss falls at home, but now is becoming increasingly anxious about falling. And the person who's supporting them, perhaps it's a husband or a wife, is constantly monitoring the medication and the environment to reduce the risk of falls, but worries about the long-term impact on their partner's mobility and independence. And also, we all are aware too that falls can lead to hospitalization and emergency room visits, and therefore increased healthcare costs. So this certainly can impact both the individual with Alzheimer's disease and their care partners. Here you'll see a list of fall prevention tips, not only for the person living with dementia, but also for the care partner. So looking at A lot of these I mentioned when I talked about the 8 A's, but just reviewing those, the areas such as removing hazards. So we want to keep those pathways clear of clutter and ensure that there's no loose rugs or cords that could trip the individual with dementia. I mentioned the proper lighting earlier, so ensuring rooms are well lit to improve visibility, especially in areas like hallways and stairs and bathrooms. Using those assistive devices, using the walking aids or grab bars in the bathroom or near stairs to provide support and stability. Sensible footwear. So wear supportive non-slip shoes or slippers indoors to prevent slipping. Regular exercise, so engaging in physical activities that improve balance and strength and flexibility, such as gentle yoga or perhaps participating in one of the Alzheimer Society programs, Minds in Motion, or active living programs. Medication management. So keeping track of medications and their potential side effects, especially those that could affect their balance or cause dizziness. Vision and hearing checks, regular checks for correct the vision and in hearing to enhance awareness of the individual's surroundings. Environmental modifications, and as I mentioned with the image or that slide that I showed you of the bathroom, so consider installing handrails and raised toilet seats or shower chairs to reduce the risk of falls. Safe bathing, using non-slip mats in the bathtub or shower, and consider a handheld shower head for easier bathing. And lastly, for people living with dementia, it's those cognitive aids. So using memory aids and reminders to help remember safety practices and routines. So for the care partner, with the care partner, we want to encourage them to supervise, so keep an eye on the person living with dementia, especially in areas with fall risks. Communication, using clear, simple instructions, and encourage the person to ask for help when needed. Assistance and mobility. So this is where we're offering support when walking or moving around and being aware of any changes in balance or gait. So we're constantly doing an assessment. And the home safety assessment. So regularly assessing the home environment for potential fall hazards and making necessary modifications. Fall detection technology. So just considering using devices that can alert you if a fall does occur. Fall prevention education is another one. So always expanding our knowledge and understanding about fall prevention strategies and techniques for safely assisting the person living with dementia. Looking at various support networks, so seeking support from healthcare professionals or support groups or respite care services to help manage the caregiving responsibilities, because it can be exhausting when you're supporting a person living with dementia 24/7. So navigating the services that are available. And then self-care. So taking care of your own physical and emotional well-being to ensure you can provide the best care possible. So whether you're a care partner, a formal care partner or an informal care partner, really it is so important to look after ourselves in order to look after others in the best way we can. Having an emergency plan is also essential. So it's a plan in place for responding to falls or emergencies. I often share with our clients a 222 plan. So having, if I wasn't available for 2 hours, who would be the person that would be available to sit with my person living with dementia for 2 hours? Who's my primary and who's my secondary? And then thinking about 2 days. If I wasn't available for 2 days, who's the primary, who's the secondary that would be able to support? And lastly, maybe 2 weeks if I wasn't available. So having an emergency plan is can again alleviate a lot of that worry, knowing that we have those plans in place. Those regular check-ins, so just monitor the person's condition and any changes that may increase their risk of falls. And then just adjusting those care strategies accordingly. So we're constantly adapting to the individual's brain changes. So we need to constantly assess and review, how are they doing now? Do we need to do anything differently that would make it easier for this individual to adapt to their environment or adapt to the changes that they're experiencing? So a person with dementia, I always say in terms of communication, a person with dementia may not remember your name, but they will remember how you make them feel. And this is where it's so essential to make your interaction a positive one. And this requires patience and empathy and understanding. So in order to build a level of comfort or a trust-based relationship with the person that you're supporting, using clear, simple language can help the person to understand exactly what it is that you're trying to communicate to them. So speaking slowly and clearly, using short and simple sentences, avoid using complex words or phrases. Perhaps instead of saying, be careful not to trip over the rug, say instead, watch your step on the rug. So maintain eye contact, face the person and maintain eye contact to help keep their attention and make them feel more engaged. So it could be, I see you're trying to get up. Let me help you stand up safely. Provide reassurance. Be reassuring and positive in your tone to help alleviating any anxiety or confusion the person may be feeling. You're doing great. I'm here to support you and make you, or just make sure that you feel you stay safe. So you're doing great. I'm here to support you and make sure you stay safe. And that's that providing assurance. Offer simple choices. So giving the person limited choices rather than a list to help them feel more in control and empowered. Would you like to hold my arm or the handrail as we walk down the stairs? Using visual cues. So using gestures or demonstrated actions to help the person understand what you're saying. So if you're talking about stepping over an obstacle, demonstrate how to lift your feet over it. Avoid arguing or correcting. If the person says something incorrect or disagrees with you, avoid arguing or correcting them. Instead, try to redirect the conversation or focus on the present moment. So if the person insists that they don't need help, you can say, I understand. Let's just take it slow and see how you feel. Encourage independence. So encourage the person to do as much as they can safely, but be ready to assist when needed. So it could be that you just say you're doing a great job walking. I'll just be here to support you if you need it. And lastly, using that positive reinforcement. So acknowledge and praise the person for their efforts and achievements. You're doing so well with your walking. Keep up the good work. We all love to be have that positive reinforcement in our lives. So by applying these tips, you can help improve communication with the person living with dementia and establish a trust-based relationship, making the interactions more positive and supportive. And as I said in the beginning, they may not remember your name, but they certainly will remember how you made them feel. So making that interaction a positive one goes a long way. Now, at this moment, I thought perhaps I would just share with you a case study, and maybe in the chat box, you could provide some ideas on how you would support Mary. So Mary is a 72-year-old woman diagnosed with Alzheimer's disease 6 months ago. She lives alone in a 2-story house with her husband, John, who is her primary caregiver. Mary's symptoms include memory loss, confusion, and difficulty with balance and coordination. She has a history of falls, with the most recent fall resulting in a fractured wrist. John is concerned about Mary's safety at home and is seeking guidance on how to support her and minimize her fall risk. Some challenges are that Mary's cognitive decline has led to difficulties in remembering to use mobility aids such as a walker or handrails. She experiences episodes of confusion, especially during the evening, which increases her risk of falls. And Mary tends to wander around the house and sometimes forgets where she is or what she was doing, leading to falls or accidents. What types of strategies can you come up with that might perhaps support Mary and decrease or minimize her risk of falls? Maybe Michelle, you can just read out some responses.
Yep, sure. Sorry, I thought you can view the chat if you'd
Oh,
like.
can I? I can't seem to see it. Oh, here we go.
But yeah, we have good lighting in the evening, signage for areas of the home. One person suggests potentially textured stairs, a walker within reach. Just confirming that you're able to see those too, Sandra.
Yes, I
Awesome.
can now.
Okay.
Yes.
Yeah, lots of suggestions
bright
coming in.
colors,
I've
handwritten.
had a chance to think about it.
Using lighting, gentle reminders and assistance. Excellent. Stable railing, available walker. Consider having the essential. Yes, excellent. If it's possible to move their bedroom. Yeah, excellent. Thank you. Very good. Yeah, so a lot of those things is what I would suggest as well. I also thought about medication management, so ensuring Mary takes her medications as prescribed to manage symptoms that could contribute to falls, and discuss with Mary's healthcare provider the possibility of adjusting medications to minimize those falls. I think it looks as though that you had all of those things. Excellent. Thank you for that. And I think also the educational support for care partners and healthcare professionals. So referring the individual to the Alzheimer Society can also be beneficial, providing John with education on dementia progression, perhaps including the impact of on mobility and fall risks. And maybe some training around proper lifting techniques and strategies. And just conducting some regular check-ins until John feels a little bit more comfortable and confident in supporting Mary in her condition. So by implementing the strategies and receiving ongoing support and education, John can certainly better support Mary in managing her dementia symptoms and minimize her fall risks and therefore enhance her safety and quality of life at home, because that's essentially what we all want to see for Mary and for John. So just as kind of a wrap up, Alzheimer's and related dementia are progressive. They're neurodegenerative disorders that affect cognitive function, memory, and behavior. People living with dementia are at a higher risk of falls due to factors such as impaired judgment, reduced mobility, and medication side effects. Cognitive decline can affect their ability to recognize hazards and prevent falls. And creating a safe environment by removing those tripping hazards, installing grab bars, and just ensuring good lighting, regular exercise, medication management, regular vision and hearing checks can reduce those fall risks. The 8 A's of dementia can impact a person's ability to navigate their environment safely. So understanding these A's can help caregivers anticipate and address specific challenges related to fall prevention. And lastly, fall prevention tips tailored to the needs of people living with dementia can help them to stay safe and maintain their independence. Care partners do play a crucial role in implementing these tips and providing support to reduce the risk of falls. So the Alzheimer Society, we offer resources, education, and support services for both people living with dementia and their care partners, and provide guidance on adapting to changes in cognitive function, implementing fall prevention strategies, and accessing communities resources for additional support. So encouraging clients, residents, or patients to contact the Alzheimer Society for that support. Any questions? Any questions people may have?
Well, thank you so much, Sandra. Before we get into questions, and perfect, having your contact information there is great for anyone who wants to take that down. I do want to say thank you, Sandra, for such a fantastic presentation. It was so comprehensive and so appreciative of all those practical examples and practical tips along the way. We did have a few people submit their questions in the Q&A box, so we'll get to those in a second. I just want to remind everyone that when the webinar has ended, you will be redirected to a survey in your browser. And if you can participate in that evaluation survey, it's much appreciated. It'll help us to continue to put on quality webinars like today's. But yeah, now I'll shift gears to the questions. So the first one that we had come in was, is it sometimes best to not practice walking with a patient who has dementia, who is at high risk for falls and unable to walk on their own? We have a worry that practicing walking with someone who cannot do so on their own sends the wrong message. They forget that they need an aid or need assistance and may get up on their own and fall, for example.
So if you build it into the person's routine of the day, of course, their mobility, an individual with Alzheimer's disease, the progression of the disease will impact the individual's mobility, and eventually they will not be able to walk anymore. But my thought is that we always, we're constantly assessing the person and see how they are in that moment. Are they able to walk today? But also being aware that they may not be able to walk a great distance. So if that's the case, then it perhaps is that we have two people accompanying the individual with the walk. So you could be the one guiding the person, either using their walker, and the other person has the wheelchair behind them. The person may, you know, the risk of the person forgetting that they can't fall is a risk that I guess we have to have that discussion within the facility on knowing that because we can't restrain the individual, knowing that the risk does exist, that the person may fall. So just regular supervision on trying to minimize the risk as much as possible.
Great, thank you so much for that. The next question is, what can we do differently to support staff aside from what institutions have already have in place? I think some of your presentation did address that for sure, Sandra. Any other examples or specifically, specific to this question?
You know, I think my thought is, and I always encourage healthcare professionals to, if you take the time, you save time. So, you know, sometimes it may be a lot quicker to take a person to the dining room, for example, in a wheelchair. But if you give them the opportunity to walk, as I said, with this an assistive device, it's going to take a little longer, but it still enables the individual to feel to maintain a level of independence for as long as safely possible. And we're constantly assessing that. I don't know if I can say anything else other than to try to help support a person's independence for as long as possible without completely taking over. So what is it that that person can still do and capitalize on their strengths, compensate only for their losses?
Thank you. I see we have a couple of questions coming in through the chat box. Just a reminder to use the Q&A function. It's in the toolbar on Zoom at the bottom of your screen. And if you put a question in the chat, if you could just move it over to the Q&A so we can track it and make sure it gets answered. I'm going to move on to the next question in the Q&A. And oh, actually, it's for me and I can answer it for everyone. Do we get a certificate of completion once the webinar is complete? Yes, you will be emailed a certificate of completion within the next couple of days. So just keep that in mind. Thanks for your question. And oh, the next question in the Q&A was along those same lines. So hopefully that answers it as well. I'll take one of the questions that got put in the chat box. They ask, there is research that walkers can increase fall risk for people who have dementia because it involves new learning. You had mentioned recommending assistive devices and wondering if you could speak more to that.
Yeah, so the assistive devices basically are the walkers or the canes or yeah, the walkers and the canes. And I'm not familiar with any research that indicates that it could be increased as a fall risk. However, for individuals with dementia, you can use you can focus on procedural memory. So if you're constantly reminding the individual to use the walker or providing cues for them to use the walker, they may then get used to accompanying using the walker. So it's a procedural memory that we're constantly doing over and over again, like the individual who just moves into a long-term care facility and doesn't know where their room is, but after a few weeks they can find their room with no problem. We maybe have put arrows up or signs up to indicate where their room is, and now they're able to find it. So the procedural memory of using an assistive device, focusing on that, can be beneficial.
Thanks, Sandra. And also just wanted to note that a couple of people did mention the SUMAC tool. And that is the Safe Use of Mobility Aids Checklist developed by Dr. Susan Hunter. So I did post the link to that in the chat, and in the Q&A, someone kind of put in their comment on the topic. They said, I tend to encourage the use of walker early with dementia, even though they can still ambulate a few steps with no walking aid. I find that the longer they have walked with a walker prior to the more advanced stages of dementia, that they tend to remember more to use their walker. So that's a great tip too. Thank you, Julie.
Excellent. Yes, very good.
All right, the next question. Oh, sorry, go ahead.
There was a question about, okay, how can a caregiver hold the client to stay in the house during a winter day? The client had been used to walking outside even during a winter time before she had Alzheimer's. Oh, yes. So again, that's a regular routine for the person. I think it depends, like, why is it the care partner not letting the person go for a walk outside, even though it's a winter day? We all go for walks out on a winter day. If we're dressed appropriately and wearing proper footwear, the thing about a winter day that we have to be careful of is if there's a blanket of snow, there's no contrast in color either, right? It's all white. So when we're walking with the person, we have to be careful of the difference in surface from the sidewalk to the road. If it looks all white for a person with dementia, there's no depth, right? But I would actually, it depends on how that care partner is. I would still continue to facilitate a walking activity with the individual with dementia to get that fresh air, because there's so many benefits to that, of course. Then they can sleep at night as well. If it's an utter snowstorm outside, then perhaps it's looking at another option. Maybe it's using, I'm just thinking of those pedals, where you sit and just pedal in the chair. Again, doing some type of physical activity while they're indoors to keep them from being too restless is what I would suggest. Or having them, if there's, if depending on how large the house is, that we do some laps around the house or inside the house to again stave off some of that restlessness that the individual may be having.
Great.
But otherwise, I would encourage people to be outside, whether it's winter or whatever. I mean, we have the weather we have the clothing for it, and if that person is accustomed to being outside, those routines are really important. Sorry, Michelle.
Yeah. And the next question is there a forum you recommend where people can share their experiences and be a possible source of good energy and inspiration for those caregivers or family members?
Oh, yes. I'm just trying to think of what it's called again. You know what? Can I get back to you on that one?
No problem at all.
Yeah.
I can include it in the post
Okay.
post-event email if you get that to me, Sandra.
Okay, I will.
The next question, if a person living with dementia is prone to roam and becomes agitated and difficult to redirect, what would you suggest as potential for assisting to negate the behavior so that both that person and the other residents in the area are kept safe?
Oh, so where are they heading? I would have that conversation. Oh, where do you need to go? And if that's what we need to start with, and then validate that person by saying, oh, you want to go home? Tell me about your home. So talk to the person about their home, or okay, well, and if they're in the long-term care facility and they're wanting to exit, remember how I said if we take the time, we actually save time in the long run. I myself have worked in long-term care and taken people outside. So here we are just walking around the little parkette. And it could have been quite cool outside, and they want to go back in because it's too cold. Or they just feel that once that little walk around is sufficient, and we're just talking about maybe the place that they were wanting to go to. So exploring that a little bit more. If it's home, it may be that they just miss familiarity, or they miss their mom, or they're hungry because, at home there's food. So we need to explore that a little bit more. What is the meaning behind the person's behavior? Essentially, that becomes the question. What's the meaning behind the behavior, and how is it that we can support this person?
Great. The next question, what do you do for a resident that refuses care, or they also followed up with refuses to turn in bed during care and does not respond to medications? The resident is aggressive only during care, regardless of medication changes. Reapproach is the most effective way to reducing aggression, but sometimes that almost takes 6 hours to safely provide care that resident needs. Any thoughts around that?
Reapproaching is lovely. I think it's always about, again, my last comment was understanding the meaning behind the behavior. So why is this person behaving this way? What is it that I need to do differently? Is the patient or resident uncomfortable when I'm providing care? Was there a traumatic experience that the individual had? Is it that does the person accept the care with others, but not accept the care with you? And is it because, is it because of the words that I use? Is it my approach? Is it because I remind that person of someone else? You said it may take 6 hours to reapproach, so sometimes we have to, 6 hours, at least the care got done. What is it? We have to be aware that it's not about punching the clock to get the task done. We're focusing on the person, not the task. So if we're still able to get the care done within our 12-hour or 8-hour shift, and the person is a lot happier by the way that we've done it. Maybe the person doesn't like to get up at 8 o'clock in the morning. Maybe they were a person that slept in. So what is it that we need to know about this person in order to give them really good care, and feel good about ourselves at the end of our shift, that we were successful in supporting this person.
Thank you. All right, the next question, they ask, are there ways families can reinforce safety tips and fall prevention they put RH, I'm gonna assume retirement home staff? I find I am encouraging families a lot lately to talk to the doctor and bring in the strategies and tips that family members and I create together.
That's a lot to that one.
Yeah.
Just trying to find where it is that you read that.
If you
so you're creating, just summarize that. You're creating
director of care, not doctor, sorry. They're wondering if there are ways to reinforce safety tips and fall prevention to retirement home staff.
Oh, yeah, it would be just reinforce. It's just constant reminders of using these. If they want to minimize the risk of an individual falling, applying what it is that you're suggesting is best practice, and that's all you can do. I think you're doing your best to educate a retirement home or the staff in that facility about those risks and what strategies are best in this particular case. Now it's up to them to apply it. And that's all you can do, and constantly encourage them to apply those strategies.
Excellent. All right, we are at 1 o'clock. So there is one more question that I will ask Sandra afterwards, but it's not directly related to this topic. So I figure I'll wrap up right now. Thank you again, Sandra, for such a fantastic presentation. Like I said before, it was great to have so many practical tips. It's such a comprehensive overview of Alzheimer's and other dementias, and how we can mitigate fall risk for those living with Alzheimer's and dementia. Thanks everyone for being here today. If you have to run, thank you again for being here. And we're just going to go over one last question to make sure that it's on the recording. But have a great afternoon to those who aren't able to stay on the line past 1. All right, Sandra. So the last question is wondering if there's any nutritional information that a caregiver it might be given from the society. Is there any nutritional resources that the Alzheimer Society provides caregivers?
Other than our brain health food guide, is being specific as to, are you looking for like diet strategies, or perhaps how to support a person at meal times?
They don't say. I guess either would be of relevance.
Okay, so I have the brain health food guide, but I also have supporting a person at meal times and getting them to eat. So I can provide, again, I'm not sure how, I don't have that document handy, but I can certainly email it out.
Yeah, if you provide it to me, I'll include it with the post-event package.
Okay, that's perfect, Michelle. Thank you.
Alrighty, well, I think that's it for anyone who's still on the line. I know I was having to split my attention, but there were some questions about some more questions about assistive devices in the Sumac tool that we put the link in the chat to. There are some previous Loop webinars on the topic of assistive devices for people living with dementia. So if you are a Loop member or you've signed up, you can access those recordings. You can put assistive devices into the search bar and those webinars will come up. Or if you're on our archived webinar page, there is a category called Technology and Mobility Aids. And if you select that, they will all come up for you. So thank you again, everyone, for being here. And thank you, Sandra, for such a clear and informative presentation. It was so lovely to have you.
Thank you very much. It was a pleasure being here.
Bye, everyone, and have a great afternoon.